You may think that a home health aide and a CNA do the same job, but they don't. In this video, I'm going to break down the differences between the two of them so that you can make the best decision for your loved ones. My name is Mitchell Brodsky. I'm a licensed physical therapist and patient care coordinator with Premier Companion Care Services. If you have more questions about home care, feel free to check out the rest of our videos on our channel. What is a certified nursing assistant, or a CNA? Very simply put, it's a home health aide with a higher level of education. You have to go to school to get your CNA license, and you're able to perform all the duties of a nursing assistant. So what are those things? You're going to be doing bedside tasks, such as changing linens, helping patients clean up, bed baths and sponge baths. Sometimes you're going to be getting them out of bed and actually doing personal care and grooming. A CNA also works a lot more in the hospital setting than they do in the personal care setting. A lot of times, there's not enough nursing staff on a floor to get to all the patients when they need to go to the bathroom, get some water, they haven't gotten their meal, anything like that. That's where a CNA really comes in to shine. They're able to pick up that slack that the nursing staff can't and be one-on-one with a patient for the little things that keep them comfortable in a hospital setting, a skilled nursing facility, an independent living facility, or even at home. What is an HHA, or a home health aide, sometimes also called a DCW, or direct care worker? Simply put, it's somebody who's willing to do the job and take on the responsibility of taking care of somebody in a personalized setting. Can be in a hospital, can be in a skilled nursing facility. A lot of times it's in their own home. However, they don't have the same license as a certified nursing assistant. You don't have to go to a formal school and get an actual license to be an HHA. There are some certifications for an HHA, but it's far shorter than what you would need for a CNA. So what is the difference between a CNA and an HHA? Well, simply put, licensing. CNA has to go to school for a lot longer and earn a different degree than a home health aide. Now, what does that really mean? With a CNA, you're going to open a lot more doors for yourself in terms of where you can work. So that can more likely be in a hospital system, in a skilled nursing facility, in an independent living facility. A lot of times, those more formal healthcare places are going to want a CNA over just an HHA. The difference also being pay scale. A CNA is going to get paid more than an HHA. Simply put, because you went to school and you had that investment and you had that time frame, you're going to be able to ask for a higher salary than you would with an HHA. Now, with a home health aide, you're able to pretty much start immediately. A lot of companies will hire you if you have relevant experience. So let's say that you took care of your grandmom for a couple years and now you have some experience in elder care. That translates over to taking care of other patients. So if you can demonstrate all the skills and competencies that you would need to take care of somebody, a lot of times you can go and take care of other people in their home too, without having to invest time and money into a CNA school. But don't expect as a home health aide that you'll get a job right away at a hospital or a skilled nursing facility, simply because they're probably going to want to gravitate towards CNAs. Also, another major difference between a CNA and a home health aide, a CNA is going to be responsible for more medical tasks and find that their day-to-day is closer towards setting up medical equipment, observing changes in patient status, versus a home health aide is going to be more tasked with personal care, grooming, bathing, light housekeeping, meal prep, things like that. So how are CNAs and home health aides the same? A home health aide and a CNA have a lot of overlapping roles as well. A lot of those overlapping roles are personal care. Now that's going to be things like bathing, grooming, dressing, activities of daily living. And this is all to ensure that your loved one has the highest quality of life. If they can't perform those tasks themselves, then either a home health aide or a CNA can do that for them. So let's get to the big question of, do I hire a CNA or do I hire a home health aide? If you find that you need somebody really to just step in for your role of bathing, grooming, dressing, cleaning, the day-to-day tasks that keep your loved one comfortable, that's a home health aide. If they're at home and they don't really have an advanced medical need, absolutely a home health aide is going to be a better option for you. It's also going to be a better budget fit for you. You don't need to spend the extra money and hire a CNA when a home health aide can do that same job perfectly. Now, a CNA is going to shine where there's more advanced medical care in place. So that's going to be things like your loved one's using an oxygen concentrator. They have a lot of hospital, equipment in their home, or they're not in a home setting. If you find that your loved one is at a skilled nursing facility or they're at a hospital itself and they're there for a while and you want somebody to be there with them to ensure their comfort, that's going to be a CNA. In those situations, because of the advanced medical need of the client, I would highly recommend to hire a CNA over a home health aide.